Hello, I'm Dr. Marisa Weiss. I am founder and chief medical officer of Breastcancer.org, and I'm thrilled to have with me today Dr. Beth Dupree. Dr. Dupree is a breast cancer surgeon extraordinaire. She is the medical director of the oncology service line at the Northern Arizona Healthcare System. And she's also an amazing friend and colleague and has been a backup mom to my children who've been passing through her neck of the woods. Welcome, Dr. Dupree. Welcome, Beth.
Thanks, Marisa. This has been it's definitely a transformational time for everybody. And it's kind of taken a group effort to come up with what's the best practice for us to do for our patients, because people are obviously concerned about COVID itself. And then you take COVID and you put on top of that a diagnosis of cancer. And so there's a double layer of fear. So one of the things that I've been trying to do a lot is just kind of bring things back down to a place where we empower our patients, we educate them with the knowledge that we have regarding, cancer care and how, and, I've done a lot of the things that I'm doing with my patients now for years when they've had life events and things coming up to delay their surgeries. And we have a lot of data to show that it's safe in many of these cancers to wait the 10 to 12 weeks that it's going to take us to get through this really acute period. So there's an organization called PanSurge, which is through the UK, where I've been participating in webinars every week between Singapore and China, Singapore, Italy, and Spain, looking at how surgeons have been dealing with the pandemic. And, one of the greatest things that came out was the American Society of Breast Surgeons. Jill Dietz is our president. She spearheaded this group to come together to say, okay, how do we best treat our patients during the COVID-19 pandemic crisis, and kind of using data-driven resources so that we can be empowered as primary frontline caregivers to let our patients know, this is what you have, this is what we're going to do, and this is our why. And it's really been helpful because now we are starting to do several virtual plan of care appointments with patients who were kind of in that zone that have been diagnosed over the past 5 to 6 weeks. And we realize that touching base with them and clearly delineating what their plan of care is and that everyone is on page is so important.
Absolutely. Just, reducing the uncertainty, coming up with a plan, having open lines of communication, and knowing who to call and what to call for makes a huge difference.